Hello there, everyone. My name is Sadia. I'm a business psychologist for 2Health. Welcome to this series of free webinars run by 2Health, which is an occupational health services provider. And we provide wellbeing solutions such as today's awareness session, as well as workplace needs assessments, along with other solutions that can be tailored to your specific needs. So this very short webinar aims to provide a quick whistle-stop tour and overview of neurodiversity and well-being. And in this webinar, we will explore how we can move from awareness to action using practical strategies to support neurodivergent individuals in promoting their well-being. I will also present an overview of some of the accommodations you can make in the workplace and education, some self-care and stress management strategies, and the importance of advocacy and self-advocacy. So I want to start by defining the concepts of well-being and neurodiversity. So if we start with what well-being is, this refers to a state of overall health, happiness, and satisfaction in life. It encompasses physical, mental, and emotional aspects, as well as social, spiritual, and environmental dimensions as well. And when we talk about mental health, that refers to a person's overall psychological well-being, including their emotional, psychological, and social functioning. It is an integral part of overall health and involves factors such as the ability to cope with life's challenges, maintain positive relationships, and make healthy decisions. Good mental health allows people to realise their full potential, work productively, and contribute to their communities. Conversely, poor mental health can affect a person's ability to function, leading to various mental health conditions such as depression, anxiety, and bipolar disorder. Mental health can be affected by a combination of genetic, environmental, and lifestyle factors. It is essential to take care of your mental health as well as your physical, emotional, and social health, social well-being as well. Just want to come on to defining neurodiversity. So this term neurodiversity, it's an umbrella term which captures a number of learning difficulties and developmental difficulties as well. It's the concept that neurological differences such as autism, ADHD, dyslexia, and others are the result of normal, natural variation in the human genome. And neurodiversity should be viewed as a positive and valuable aspect of human diversity, which can enhance innovation, creativity, and problem solving in all areas of society. Now, some of the common terms I've listed here, you might have heard of the word neurodiverse, neurodivergent, SPLD, so this is specific learning differences, or special educational needs and disabilities. So these are the terms that tend to be used in education. You may also hear the word neurodifference or neurodevelopmental, as well as the term neurotypical. So that would refer to somebody that does not have a neurodivergent condition or a neurodiversity. The idea of neurodiversity is that it seeks to embrace difference, but it also recognises that some people who are neurodivergent will need extra support. And we're trying to move away from the medical model of abnormality or something that needs curing. It's important to understand that these conditions that I've mentioned here are lifelong conditions. They cannot be cured, but they can be successfully managed. In fact, it is estimated that up to 1 in 7 people have a neurodivergent condition. Shown here are some of the key conditions that fall under neurodiversity. So we have dyslexia, dyspraxia, also known as developmental coordination disorder. We have dyscalculia, ADHD, so this is attention deficit hyperactivity disorder, autism or autism spectrum condition or disorder, ASD or ASC, it's also known as. Excuse me. And it's also important to understand that all of these are neurological or brain-based conditions, which means that people with a neurodivergent condition process information differently. And the impact of these conditions on a person can vary from day to day, as well as from individual to individual. These conditions can also co-occur. So, for example, dyslexia and ADHD can occur together. So let's explore these conditions a little bit further. So neurodiverse conditions can have their own challenges. In terms of autism, this is a neurodevelopmental disorder which is characterized by difficulties in social interaction and communication, as well as restricted and repetitive patterns of behaviors or interests or activities. And often people with autism may experience sensory overload, so they may be overly sensitive to light or textures or smells or noise, for instance. But as well as this hypersensitivity, they can also experience hyposensitivity, so they may not be as sensitive to light, for instance. Now, autism is classed as a spectrum disorder. This means that it manifests in a wide range of symptoms and severity levels. And some of the workplace adjustments that employers can make, or colleagues or team managers, can include things like providing a structured routine. You can ensure that communications are clear. You can allow for quiet or private workspaces, minimizing sensory distractions. You can also ensure that that you provide social breaks to recharge and also offer opportunities for skill building and training. Moving on to dyslexia. So people with dyslexia often struggle with reading, writing, and spellings. And some of the workplace adjustments that can be made include things like providing written instructions, as well as using a dyslexic friendly font, which can be anything which is 12 or more. So as well as where the letters are easily, you can differentiate between the letters quite easily. So for instance, Calibri, Times New Roman and Arial are popular ones. And they're also dyslexia friendly. You can provide people with extra time for their reading and writing tasks. You can provide assistive technology, so speech to text or text to speech software, for instance. You can also provide training and mentoring opportunities, as well as offering accommodations for testing or exams. So think about the format of the exams. Think about allowing more time for an exam, for instance. So developmental coordination disorder or dyspraxia. So people with dyspraxia often struggle with motor coordination, planning, and organisation. And some of the workplace accommodations can include things like providing concise instructions in a written format as well. You can provide extra time for tasks that do involve the use of either fine or larger motor skills. So for instance, anything that requires a small muscle groups is known as fine motor coordination, and anything that requires the use of your larger limbs, so your arms and legs, is known as your gross motor coordination. So again, you can provide assistive tools and equipment. You can ensure that distractions are at a minimum. You can provide flexible work schedules, as well as opportunities for training and development. Dyscalculia, this affects an individual's ability to understand and manipulate numbers, making tasks that involve maths quite challenging. And that can also include challenges with timekeeping and understanding money. Workplace adjustments can include things like speaking calculators, using digital tools, or visual representations of numerical data. Ensure that any instructions are clear. You can also provide extra time as well as additional training to support employees to help them develop strategies to manage their difficulties. Now, often the focus is on areas of difficulty. It's important to understand that neurodiverse individuals have many strengths too, and research has shown that they possess unique strengths like the ones that I have shown here. They are by no means exhaustive, so there can be others as well. But to take an example, so for instance, they can be creative in their approach. They can be highly empathetic because of the challenges they face. They will understand people better. They may also take a very determined approach. They can be good verbal communicators where there is no dyslexia, for instance. They can also be very good problem solvers. They can think, they might have very good spatial awareness, so be able to think visually. They may have very good long-term memory. They may also be highly analytical in their approach. So overall, by embracing neurodiversity, you can create a more productive and inclusive workplace environment by understanding that neurodiversity brings with it, people with a neurodivergent condition can bring strengths to the organisation as well. Now, people with a neurodivergent condition in the UK often face unique stressors that can impact their well-being. And research has shown that neurodivergent individuals are more susceptible to experiencing stress due to various factors, including difficulties with sensory processing, social interactions, and executive functioning, which refers to a set of mental processing or cognitive skills that enable people to plan, organize, prioritize, and problem solve. Increased stress can significantly impact their mental health and overall well-being, leading to higher rates of anxiety, depression, and other mental health conditions as well. So it is crucial to acknowledge and address these stressors to support the mental health of neurodivergent individuals in the UK. Some statistics related to neurodiversity and mental health in the UK. So according to the National Autistic Society, 70% of autistic adults in the UK have mental health problems such as anxiety, depression, and obsessive compulsive disorder. Adults with ADHD in the UK are at a higher risk of developing mental health problems such as depression, anxiety, and substance abuse. And that's according to the National Institute for Health and Care Excellence. And according to the British Dyslexia Association, people with dyslexia are at a higher risk of mental health problems, including anxiety, depression, and stress. According to the Dyspraxia Foundation, dyspraxia is associated with an increased risk of mental health problems, including anxiety and depression. So I think it's quite important to acknowledge and address the stressors faced by neurodivergent individuals and to support their mental health. So here are some specific self-care and stress management strategies that you can use. So try to ensure that you manage any sensory overload by utilizing sensory rooms, for example, or designated quiet areas. You can try and use noise cancelling headphones, or earplugs can be used to reduce auditory stimulation. You can also try to use fidget toys or comfort objects for tactile or visual grounding. Think about planning travel during less crowded times or choose less busy routes when possible. You can also try deep breathing or grounding techniques to manage anxiety or stress. You can try and engage in mindfulness and relaxation exercise, and this can help to activate the body's relaxation response, reducing the production of stress hormones such as cortisol. And this can lead to a decrease in stress levels and promotes a sense of calm and tranquility. Mindfulness and relaxation exercise can help people to develop effective coping mechanisms to navigate the stressors in their lives. And by building resilience, individuals can be better equipped to handle challenges and bounce back from adversity. And mindfulness practices have been linked to improved physical health outcomes, including reduced blood pressure, improved sleep quality. And these physical health benefits can contribute to the overall well-being of a person. And there are some free mindfulness and relaxation apps that are available that can help people practice their mindfulness and relaxation exercises, for example, Headspace and Calm. So connecting with like-minded individuals through community support groups specifically tailored to neurodivergent individuals can also provide a supportive and understanding environment where individuals can share their experiences. So actively exploring local special interest groups or clubs or hobbies can empower individuals to build meaningful connections with like-minded individuals, which can all go towards fostering a supportive network and promoting overall well-being. So by implementing these self-care strategies, neurodivergent individuals in the UK can effectively manage stress and reduce anxiety and promote their overall well-being. So in the context of supporting neurodivergent individuals, advocacy and self-advocacy play quite an important role. And when we talk about advocacy, this involves promoting the rights and needs of neurodivergent at a more broader level, which is important to raise awareness, influence policies, and promote systemic change. And when we talk about, it also involves trying to reduce stigma, as well as improving the overall well-being of neurodivergent individuals. Self-advocacy, on the other hand, empowers individuals to express their own needs and preferences and advocate for themselves. Both advocacy and self-advocacy contribute to creating a supportive environment for neurodivergent individuals. And all of this can in turn promote the mental health and overall well-being of neurodivergent individuals, enabling them to thrive in all aspects of life. So here are some considerations on how to foster an inclusive environment for people with neurodivergent conditions. Think about ensuring that your recruitment process is accessible to all. You can train your managers or employees on how to support people with neurodivergent conditions. You can try and provide accommodations such as flexible work hours to accommodate employees with sensory sensitivities. Also ensure you encourage open communications between employees and their supervisors to discuss any support that they might need. So create a system for employees to be able to request accommodations without the fear of discrimination. Ensure that all employees are educated about neurodiversity, and this can help to create a more accepting and understanding workplace culture. You can also offer employee resource groups or support groups, and this can help people to connect with others who share the same experiences. And it is all about ensuring that you do take an empathetic and understanding approach. So some of the support offered by 2Health includes awareness training, which supports more people, encourages disclosure for those who are diagnosed and for those that are not. It ensures it gets the conversation going around neurodiversity and lets people know what help there is. And this in turn can have quite an impact on staff. So we offer things like coaching, co-coaching, screening and diagnostic assessments, as well as assistive technology training and awareness training. And of course, any of this support can be tailored to individual requirements. And engaging in supporting your employees keeps up the retention rate and keeps other issues such as mental health and workplace stress lower. Changes on the horizon, and more organisations have embarked on a journey towards inclusivity by promoting diversity within their workplaces. And over the past decade, there has been a significant increase in the celebration of neurodiversity. You've got influential figures such as Richard Branson and Steve Jobs. They've spoken out about neurodiversity, highlighting its importance. And whilst we may not all aspire to be the next great business leaders, their efforts have helped to build awareness, understanding, and acceptance of neurodiversity. And it's important to remember that people are multifaceted and they do not need to be defined by their thinking difference. Okay, so to wrap up, here's a quick summary of what has been discussed today. So when we talk about neurodivergent conditions, that can include things like ADHD, autism, dyslexia, dyscalculia, as well as developmental coordination disorder. It's important to remember that neurodivergent individuals do face unique challenges that can impact their overall well-being, including increased stressors and difficulties with sensory processing, social interactions, and executive functioning. Implementing self-care strategies and stress management such as sensory self-regulation techniques, mindfulness exercises, and utilising community support groups or engaging in hobbies, all of these things can effectively manage stress and promote mental health as well as overall well-being for neurodivergent individuals, as well as fostering this sense of belonging. Neurodivergent individuals also have many strengths, so rather than focusing on their challenges, think about what their strengths are and what they can bring to your team, and to utilise them in areas that harness their strengths and make the most of their strengths. Advocacy and self-advocacy are crucial in creating a supportive environment for neurodivergent individuals, which can help to raise awareness and influence policies, as well as help empower individuals to express their needs and rights. So it is important to take steps to try and create and foster an inclusive environment which promotes everybody's well-being. So I'm hoping that you enjoyed this very short webinar and that it will influence your strategies and your plans to support your neurodivergent individuals, employees. We do value feedback, so please take, you can scan the code, the QR code with your phones, and please feel free to leave some feedback. You can get in touch with us on our use it on our social media platforms. You can use the website, email, or you may call. Thank you everyone for tuning in today. I will leave this slide there just in case anybody missed it. And I hope that you are able to learn from this and take steps to create a more inclusive environment. Thank you.